Hello everyone, I am Alisha Sheikh and today the topic of presentation of mine is anti-cancer drugs. Okay, I hope you all are comfortable in English language. So let's see what are competencies to be covered in this topic. Okay, first anti-cancer drugs we'll see in detail platinum complexes compound. Okay, first of all I want you to all be attentive and then only this will be useful. Okay, so let's begin now. What is cancer? Okay, I hope you all might knowing it what exactly it is, but let's see once. Okay, so World Cancer Day, which is on February 4, cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. Cancer cells can spread to other parts of the body through the blood and the lymph systems. Basically, we can say that cancer is abnormal cell growth, abnormal and like uncontrollable cell growth. Okay, that cell growth is uncontrollable. Okay. Then next, cancer. It is a class of disease characterized by uncontrolled proliferation of the cells, dedifferentiation, loss of function, invasion to local tissues, spread or metastasis to other parts of the body. Cancer is not a single disease, it is a group of more than 200 diseases. Cancer may spread to other parts of the body. Currently, 1 in 4 deaths in USA are due to cancer. 1 in 17 deaths are due to lung cancer. Okay, so this is a particular data which you have just to keep like general knowledge kind of. It is not that much important. It will just show us which is the most common cancer. You have to remember what is most common cancer. Okay, so lung cancer is the most common cancer in men. Normally people will think men में सबसे most common cancer will be like prostate cancer, but it's not like that. Men have most common cancer like lung cancer. Okay, and the most common risk factor for it is smoking. Okay, then breast cancer is the most common cancer in women. Okay, around 15 lakh new cases are diagnosed every year in India. Then skipping all the content which is not required, will see only the required content. Okay, so treatment part is very much important for us. In treatment we'll see chemotherapy like using of the chemicals or chemical related drugs to treat the patient. Okay, then radiotherapy using the ultraviolet radiations, x-rays for treatment. Okay, that mutated cells are like being targeted by radiotherapy and we are treating the cells. Okay, then surgery, it is the ultimate most important part of the treatment. Like surgery to removal of the cancerous part is most important, so that it does not spread to other areas. Okay, immunotherapy like giving drugs which increases the immunity and which helps to regress the expanding capability of the cancer. Okay, hormone therapy, gene therapy. Okay, I hope you all are attentive. Okay, next, classification of drugs. This is the most easiest thing to remember. Okay, most easiest. We have tricks also to remember, so listen. Say, drugs acting on the cells like cytotoxic drugs, alkylating agents, antimetabolites, antibiotics. First of all, alkylating agents. I'll explain you each mechanism of the each drugs, but first listen the classification. Okay, alkylating agents: meclorothiamine, cyclophosphamide, efosfamide, chlorambucil, melphalan, busulfan, carmustine, lomustine. Okay, cisplatin, oxaliplatin, carboplatin, and antimetabolites like folate antagonist, methotrexate, purine antagonist, 6-mercaptopurine, fludarabine, cladribine, pyrimidine antagonist, 5-fluorouracil, citrabine, capecitabine, gemcitabine, antibiotic, dactinomycin, doxorubicin, okay, daunorubicin, bleomycin, mitomycin, and campothin analogs, topetecin, irinotecan, taxanes like paclitaxel, docetaxel. Basically, to remember the drugs, we have to make a trick of using prefix and suffix. Okay, so here we have make a trick for using the prefix and suffix, which will help us to remember the difficult part of the drugs. Okay, now mechanism of the action. Okay, see, basically, how will the cancerous cell multiply? By forming more and more DNA and forming new cells which require DNA. Okay, so we'll like stop the process or inhibit the process which leads to formation of the DNA or RNA or protein. So like we have seen the classification in the previous slide, here we'll see the mechanism of action of the cytotoxic agents. This is a like short recap which will come later on. First we'll see individual drugs. Okay, so mechlorothiamine, which is nitrogen mustard, it is like mechanism of action is DNA cross-link resulting in inhibition of DNA synthesis and function. Okay, root must be given orally. Side effects: nausea, vomiting, decrease in the PBL count, bone marrow depression. Please be attentive, it will be asked in MCQs. Okay, nausea and vomiting, decrease in PBL count, bone marrow depression, bleeding, alopecia, skin pigmentation, pulmonary fibrosis. It is like very least common side effects. It is not seen with other drugs. Okay, so busulfan, which is alkyl sulfonates, atypical alkylating agent, chronic granulocytic anemia, orally effective, bone marrow depression, pulmonary fibrosis, and uricemia. C, which is common. Pulmonary fibrosis was common with mechlorothiamine also and with busulfan also. Okay. Then next we'll come to lomustine, nitrosoureas. Lomustine, orally effective, nausea, vomiting, nephrotoxicity, nerve dysfunction, and lomustine is clinically applied or used for Hodgkin's and non-Hodgkin's lymphoma. Okay, remember it. Malignant melanoma and epidermoid carcinoma of the lung. And mechanism of action, I told you na, that cancerous cell require more DNA for replication. They replicate faster by forming new DNA and new cells. Okay. Then antimetabolites. Pyrimidine analog cystosin inhibits DNA synthesis. Plant alkaloids vincristine, inhibition of the mitotic spindle formation. Okay, dactinomycin, it binds to DNA and inhibits RNA synthesis. Etoposide binds to and inhibit topoisomerase 2. Okay, clinical applications of cytosine is most effective agent for induction of remission in the acute myelocytic leukemia. Okay, non-Hodgkin's lymphoma. It is used for non-Hodgkin's but not Hodgkin's. Okay, usually used in combination therapy. Next, vincristine is used in metastatic testicular cancer, Hodgkin's and non-Hodgkin's, Kaposi's sarcoma, breast carcinoma, neuroblastoma. Antibiotics: rhabdomyosarcoma, Wilms tumor in children, testicular cancer, etoposide, testicular cancer, small cell lung carcinoma, Hodgkin lymphoma, carcinoma of breast, Kaposi's sarcoma. See, the most important part we have to remember, like which is more common, like Hodgkin's and non-Hodgkin's, and Kaposi's sarcoma was common with vincristine and etoposide. So just pick up that common part and at least remember that. Okay, so that you can apply over there. Okay, now symptoms: weight loss, appetite, poor appetite, like the person does not feel hungry, severe pain, neurological symptoms, hematemesis, which is also called as blood and vomit. Okay, the night sweats. Diagnosis: how will diagnose? Physical examination, biopsy of the tumor. Biopsy of the tumor is a very classical method. Okay, CBC, newer diagnostic test like X-ray, MRI, and CT scan. Now, platinum complex compounds: cisplatin, carboplatin, oxaliplatin. Okay. Then mechanism of action of platinum complex compound. Similar to alkylating agents, cisplatin only binds to DNA and disrupts DNA functions. It also has same function like alkylating agents. It binds to DNA and disrupts the DNA function so that it does not multiply. Okay. After cisplatin enters the cell, chloride ligands or molecule are replaced by water molecule. Don't worry, I'll explain this in a flowchart way also. Okay. The reaction results in formation of positively charged platinum complexes that react with the nucleophilic sites on the DNA. These platinum complexes covalently bind to DNA bases using the intrastrand and interstrand cross-linking, creating cisplatin DNA adducts. Okay, thus preventing DNA and RNA protein synthesis. Okay, this is the flow chart. which will be very easy for you now. Cisplatin form highly reactive carbonium ion transfer alkyl groups to nucleophilic site on the DNA basis, results in cross-linkage, abnormal base pairing, DNA strand breakage. Basically, by this will also try to stop the replication or multiplication of the cancerous cell. This is the mechanism of platinum complex drug explained in a diagram format. Okay. So this platinum compound here, this platinum compound is bind to DNA and it disrupts cellular dysfunction which leads to apoptosis. Uses bladder cancer, breast cancer, ovarian cancer, testicular cancer, head and neck cancer, liver cancer, and ADR says adverse drug reaction, nephrotoxicity, anemia, autonomic neuropathy, electrolyte disturbance, anaphylactoid reactions, complications, fertility, pregnancy, breastfeeding moments. In fertility, it leads to temporary infertility conditions. In majority of the patients, among males, it leads to testicular carcinoma. And in pregnancy, it is also very harmful in pregnancy. Okay, breastfeeding moments, not recommended as cisplatin is excreted in human milk. Preventive measures, obviously, everything which is taken in excess amount or risk factors like other immunocompromised states which helps to multiplication of the cancerous states. Okay, so don't use tobacco, protect your skin from the sun, eat a healthy diet, maintain a healthy weight, and be physically active, practice safer sex and avoid risky behavior, get immunized, know your family medical history and get regular screening. I hope you are not having any questions. Now it's time for MCQs. Okay, which anti-cancer agent should be given orally? Think, answer, then say. Okay, I'll tell you answer at the last. Which anti-cancer agent causes neurotoxicity? Okay. Cisplatin comes under which group? Think, come on. Most common cancer in man. I hope you all might be thinking prostate, but it is good, lungs. Which of the following drugs used in Hodgkin's as well as non-Hodgkin's lymphoma? I told you to remember this, right? Both A and B. Okay, now let's see the answer for all. First is A, second is A, third is A, fourth is B, fifth is D. Thank you so much for your support and patience.